So yeah, Hospital Arts in the Southwest, welcome this morning. We are recording, so the audience you're already automatically switched to cameras off and microphones muted. However, the chat is live, so we're very interested to see who's on the call. Please introduce yourselves to each other, say your name. Feel free, if you want to leave contact information for others to reach you, you can. Please tell us maybe what you're tuning in for, anything in particular you're hearing about, and tell us what it is that you do yourselves. We have, we're hoping we'll have some Q&A time at the end. We have got at least 9 presentations to cram into our hour and a half, so we will be fairly high level, fast paced to see if we can do a proper tour of the Southwest. So please do pop questions as they come up in your mind, put them into the chat. And we've got the amazing Alexis in the background who is bringing those all together, and we'll share them at the end. Anything we can't answer in person in the room, so to speak, we will email you with the information afterwards. So I'm going to hopefully seamlessly take you through the content of the day. We've got introductions first. So again, I'm Penny Calvert. We also have Francis and Neil, if you'd like to give us a wave, Francis and Neil from University Hospitals Bristol and Western. We have Anushka coming in from Gloucestershire. Give us a wave, Anushka, thank you. We have Susie coming in from Dorchester. We have Hetty from Bath. We have Neda from Southampton. And we have Lisa from Somerset and Kathy from Cornwall. So introductions over. Again, please do introduce yourselves in the chat. We're looking forward to finding out more about you. And here is a little map of some of the hospitals we're going to hear from today. You can see there's this amazing gap currently in large parts of Devon and Cornwall. That doesn't mean that nothing is happening. And certainly previously there have been 2 other Hospital Arts in Cornwall, and there's previously been one on the Isle of Wight. And we are missing Guernsey in the room today, who have a subtotal of 1 whole human being. So they're busy getting some actual work installed this week and not able to join us, but send their best wishes to everybody. As well as listening in today and for the recording that will be on YouTube, if that's where you're listening to this, please do investigate the other sources of information. There is a LinkedIn page for Creative Health in the Southwest. That covers everything, as well as Hospital Arts being one part of that topic. We've got Future NHS for our NHS colleagues to join the Creative Health Hub that's there. And then we've got the Creative Health resource pack, which has got its own special page for the Southwest Hospital Arts. And you can go there to then get all the contact information, because as I described, you'll have a tiny sample of what these Hospital Arts services are doing. And there's so much more to discover. Please do take this as your invitation to get in touch, ask us more, join up to the Southwest Network and enjoy the support of this amazing bunch of human beings. I am going to hand to Neil, and we've got Francis to share slides with him. So we're heading to Neil. Small technical hitch coming in.
Yeah, morning everybody. I'll wait for my slides to appear. Thank you. Thanks, Francis. Yes, really delighted to join the session this morning. I'll do a little bit of introduction about myself and my trust, and then I've been asked to say a bit more about arts from the perspective of the Chief Financial Officer, so I will do that. So as it says there, I'm Chief Financial Officer and proud to also call myself Arts Champion for the Trust. And I normally try and weave that into when I introduce myself in other settings. My responsibilities cover all things finance, but also estates and facilities. And the arts programme teams sit within estates and facilities within our trust, but that is coincidental to me being Arts Champion, and I'll explain a bit more shortly. I imagine quite a lot of people on the call are familiar with our trust, but there's a few things I wanted to share just to set the context with some of the things I'll say later around the arts team. And within these slides, I'm sharing some work that we've done recently, resetting the vision, mission, purpose and values of the trust. And you'll see from this slide and the next that we've tried to go with quite a different colour palette to what you'll see in sort of large parts of the NHS. And all of this is under, I'm going to say, a strapline of full-hearted care, but of course, full-hearted care is intended to be much more than a strap line in terms of that's the way that we want to go around all that we do. So within the trust, I've listed on the right-hand side all of the hospitals within our organisation. And of course, it's those hospitals that our patients and public really identify with rather than the umbrella organisation. If we just go to the next slide. And again, this just says a bit more about the trust strategy, and I just wanted to draw attention to the strategic priorities for the organisation, where I won't labour the point, but I do believe that the experience of care, our people, innovation, our resources, and all of the trust values are very central to everything that the arts team does for and with the trust. My next slide. I'm not going to say much about this or the next slide because I appreciate that later on in the webinar, a lot more content is going to be shared with people with a real expert eye in terms of what's going on in the Southwest. But just sort of a couple of headlines. The previous slide about working with people, so both the patient experience as well as staff experience. I'm going to say a bit more about the photo on the top left-hand side a bit later on, and of course the role the team plays in celebrating diversity around our organisation and our communities. And the next slide, again, is very, very high level, the work the team do in terms of improving the spaces within which we work and look after patients. So I'm sure I'm not alone in sharing that parts of the real estate of our trust are in a pretty dreadful condition, and the arts team do some remarkable work. So the top left, our staff canteen transformed a couple of years ago into a space that people now meet and enjoy being. There's mention there of the percent for art policy, and I think I'd be exaggerating if I suggested that we adhere to that policy, but we do make real effort to make sure that we are thoughtful about how art can improve each of our refurbishments as and when we're able to carry them out. Right, next slide, please. So I was going to share a little bit about the history of the arts programme and the arts team within the trust. And as with so many things, it starts with the passion and drive of key individuals. So, I do want to credit Robert Woolley, who was our chief executive until 3 years ago, and Anna Farthing, who was the original arts programme director within the trust, because it was their drive, their passion that is very much the foundation of everything that's been achieved since. I do speak on behalf of the trust board in that our board is really interested in the work of the arts team, and I'm going to give a couple of examples in a moment in terms of some interaction between the team and the board. But like I say, this isn't a view held by a couple of individuals within the board. It's a strongly held commitment across. In terms of the evolution of the financial support, I might have my timing slightly wrong here, but I think it goes back to, I'd say, about 2018, when our hospital charity agreed to financially support the arts programme director post. And around a year and a bit later was when the trust made the decision to back not just that post, but a wider team. So since that point in time, we've had a recurring allocation of it's about £250,000 to support the team. And I'll say that's mainly for people, but there's an allocation for non-pay as well. And again, I'll say a little more about that in a moment. I did a quick aside in terms of the University Hospitals Bristol, when North Bristol Trust are forming a group, and we'll call ourselves a group from April onwards. Some will say that's sort of long overdue in terms of the closer collaboration of the two trusts just 5 miles apart. I did want to acknowledge that the arts teams in the two trusts have worked together very closely for years. So sort of in the vanguard in terms of sharing resources, sharing ideas, very much in the spirit of what we hope to do across the wider organisation. And then the last bullet on this slide, and you can see I keep going on about being an arts champion. So when Robert retired about 3 years ago, that vacancy arose, and I really did jump at the chance to take on that role at the board, and I just sort of give a bit about my rationale for wanting to do it. So one, of course, valuing the work that I saw going on around the organisation. I can't deny the fact that it's a really enjoyable departure from day-to-day life as a chief financial officer. So the difference that it brings to me personally, I'm not going to try and exaggerate what I do. I could do and should do more than I do, but I do make sure I advocate on behalf of the team and the work it does. I do participate in some of the events, and I do try hard to sort of share the message in terms of the value of art in hospital and healthcare settings. So I think the last time I would have used some of this material in a presentation was to around 200 of my finance colleagues around NHS finance in the Southwest. Next slide. I want to quickly mention Beth, our poet in residence. I've given you sort of a bit of background in terms of my interest, and Beth was really the first interaction I had personally in seeing some of her work with staff, with patients. Beth recently came to our trust board to speak about the work she did, and when I think back to the pandemic and some of the terrible experience for both our staff and our patients, I do think about a poem Beth wrote about some of the care in our intensive treatment unit. So for me, so when I think COVID, I quite quickly think about Beth as well, when I say the role that she played both during but in the aftermath. I'll go back to the financial context then. So I've spoken about the 250k investment the trust has made. I do think it's really important to keep that in perspective. So our trust spends £250,000 every 2 hours of its existence. Forgive me for chucking a bit of maths into so for every £1,000 we spend £20 supporting arts across our organisation. So I think some would see we've made a step, others haven't, but I think important to keep it in perspective. It's obvious that there are benefits for the team in that we've set a recurring budget. So there's no expectation the team have to sort of join in every annual bidding round to re-secure those resources, which I think has obviously an advantage in terms of certainty, but also means the team isn't put in a position where it's competing against quality and safety issues that will present themselves every planning round, every month of NHS experience. So I think that's given an advantage in terms of certainty of planning and ability to plan programmes over years as well as during the course of the year. I really appreciate in return the very strong financial commitment I have from Francis and the team to live within that resource, to grow that resource through some of their own efforts, whether that's income generation or further charity support. And so it sort of cuts both ways. I'll say a bit more about the charity on my next slide, but again, in terms of organisational context, I thought important to share that when we get into those difficult conversations through the year at the start or planning for the next financial year, I can assure you that no member of our exec board, senior leadership team ever talks about the arts programme as being an area that we should think about reducing resource, such as the value placed on the team. I've talked about trust values already, and that's how I hope you can see the coherence between those values and some of the things I've shared and I'm about to share. And then my last slide in terms of through the eyes of the CFO, I do recognise that there's always a risk, and I sort of use a crass Daily Mail headline here. There's always a risk, isn't there, of challenge externally in terms of trust investing in well-being, diversity, arts in the context of a NHS in such a challenged financial context. But personally, I'm absolutely convinced that there is a return on that investment well beyond the impact on patient and staff experience. Now, I can't say this is backed up by empirical research on my part, but as I'm absolutely confident that there are a number of tangible benefits to the investment. So first one is around impact in terms of staff. I say well-being, but well-being into recruitment and retention. And I'm going to use an example to try and illustrate that on my next slide. The impact in terms of patient experience, potentially leading to reduction in length of stay. And one of the obvious examples to use here is the impact that we know dance and arts activities on care of the elderly wards for dementia patients, where we see that really helping people turn the corner in terms of from deconditioning to a viable plan for discharge, and how a day of interaction can totally change the experience for patients and their carers. And carers, I mean family as well as staff. I've spoken about the link with the charity from the off, and I think what we're seeing a few years down the road is that some of the arts activities are helping in terms of donations to our charities, and therefore our charities are in a better place to continue to support future arts initiatives. So I'm saying I think quite a virtuous circle in that relationship. I've talked about staff recruitment and retention. I'm also making a link here in terms of staff well-being and resilience, and also the view in terms of the calming influence music or dance can have on a ward in terms of a reduction in the level of potential violence towards staff or from one patient to another. So my last couple of slides, as I say, I'm going to go back to some specific examples that really have resonated with me over the last couple of years. So the photos in this slide are taken from an exhibition called In Our Hands. So everyone you see is a member of staff at Western General Hospital, and they were very deliberately photoed in their civvies. They're holding an item of personal value and are pictured in a part of Western or surrounding area that means something to them. So this had quite a lot of profile, and all these photos remain in one of the main corridors within the hospital. And I think this had an amazing impact in terms of not just these 12 people's identity with the organisation, but their family's identity with the organisation, their community's identity with the organisation. So I think real long-lasting impact in terms of recruitment, retention, staff well-being, not just for these 12 people, but how that's span out beyond. And then next slide, I've mentioned this already, and this is again an anecdote that I found impactful and that therefore would like to share with others. And it's I'm not sure if these actual photos from the war, but we have a member of staff playing the harp in our paediatric intensive care unit, and staff speak about the incredible impact it has in terms of calming very poorly children down, which calms their parents down, which means the staff can go about their work in a much more constructive, able to care environment. And so in the last couple of slides, just choosing things that have resonated with me personally. And this is sort of this pathway, which is about 50 metres to my right. This links with another corridor that was so gloomy. It's known across the organisation as the zombie corridor. And you can see an incredible transformation of that space with a collaboration with Bristol City Council. And again, just sort of changing people's sort of day-to-day experience of how they come to work, where they come to work. And my very final slide, again, is just picking up a couple of things. I hope I haven't stolen any of France's thunder for later, but I've spoken about Dance for Dementia. The Boredom Buster, I imagine most people are aware of, but this is a activity pack we use on wards for patients with a longer stay to try and sort of ease that day-to-day inactivity. And I know the team have been really successful in sharing and selling those products to other organisations, which again creates a bit of a virtuous circle in terms of our ability to further develop our programme. And there is one more slide, again, just showing some more activities around staff wellbeing, but I'll pause there. And Penny, you tell me whether it's sort of questions now or what you want to do next.
We're going to, in order to stay on time with the other numbers of presentations, we're going to take questions at the end. So, but if you know that you've got questions fresh in your mind and you're worried that you might forget them, please put them in the chat now, and Alexis will hold them for us so that we can bring them back at the end. And again, should we be short on time, we can send that information and we can get Neil to respond by email if we run out of time in the room today, because those questions are really valuable to us. So we do want to know what thoughts are coming up in your mind as you're listening today.
You've gone to mute, I think, Penny.
There we go. Okay, so thank you so much, Neil. I'm going to take you away from that view of listening to specifically what University Hospitals Bristol and Western have been doing, and the way that the arts service there is supporting the kind of key aspects of what matters most for health and the population there, and just look at the kind of the peer group and a bit of context around what's happening across the hospital arts sector. So hospital arts is part of the wider creative health. So we see, when I talk about creative health, I'm using the definition that comes from the National Centre for Creative Health. That's from the Creative Health Review. Creative health is creative approaches and activities which have benefits for our health and well-being. Activities include visual performing arts, crafts, film, literature, cooking, creative activities in nature. Approaches, so that's the way in which the work uses creative and innovative ways to approach health and care services. It's public engagement, it's co-production, it's the skills and education. How do we get more people to be trained and capable of delivering this kind of work? Where is it applied? It can be applied in homes, communities, cultural institutions, heritage sites, Today, we're looking specifically at creative health in healthcare settings, which is what we're calling hospital arts. And that all of those activities and approaches can contribute to the prevention of ill health, promotion of healthy behaviours, management of long-term conditions, treatment and recovery across the life course. So that's what we're using when we talk about creative health today. When we think about the value that hospital arts have said, Neil's obviously touched on, for example, the value that Bristol and Western think of when they look at how their hospital arts services are reviewed. And yes, you can look at the cost, but that's really just about the sort of transactional aspect, and worth and importance can actually come out of how useful something is to somebody. So those somebodies are the patients, the public, the staff, and the usefulness. It's where are hospital arts meeting needs? What are they delivering as a result of that investment and that use of resources? Also, values in terms of behaviours. It's change is made because behaviours and beliefs change over time. How are hospital arts able to support the change in beliefs, the change in needs, and help people understand more about their health, more about how can hospital arts help increase people's skills and help them move towards better health as a result of taking part in those programs. Overall, today we are aiming that this webinar gives you a sense that hospital arts are more than a nice to have. They are part of an essential creative health infrastructure and how they deliver value through the range of local, regional and national health strategies. I'm going to very quickly skim through these because I want to dedicate as much time to going around the Southwest on our day trip of all the amazing programs. But this is just to give you a context. This is data that's come out of dissertation research I completed. We've had complete responses from at least 16 hospitals across the UK. At the time that this was taken, that was about just under 50% of the services available. And I asked about the size of the hospital that those arts services. So we've heard how big Bristol and Western are. Is there a restriction? Does it matter how big your hospital? Will it make a difference whether you can have arts and health? No, it does not. You can have a small hospital, you can have a mega hospital, you can have everything in between. The size of your hospital does not restrict whether you have arts and hospital service. When we think of the size of hospital in terms of budget, Neil touched on it here, that the large budgets, yes, you might expect them to have a hospital arts service more than a small one, but actually the picture is no, it doesn't matter the size of your hospital's budget. It's whether you believe that those resources spent and invested into hospital arts can help you meet your strategic needs. On this donut, you can see there's a portion that says don't know it. That was answers coming back from hospital arts services that were attached to their charity, so they couldn't answer the question on the hospital's budget. They were looking at charity budget. So we just mentioned hospital arts being attached to charities. Where are you going to fit your hospital arts in? There is no restriction. You can choose which department it fits into, whether it's capital, estates, the staff wellbeing side, the corporate and nursing, surgical side. You decide what suits your organisation. How big is your team? Again, this is entirely flexible. You can tailor it to the resources you have available. Perhaps you want to start small and build up over time. There is no one size that is perfect, although I'm sure everybody on this call who's presenting can tell you that bigger is often better because the amount of work simply grows over time as people realise the power of the work itself. What you can't do is expect a team that's maybe one person working part-time to deliver the same amount of program as a larger team. That's obviously not possible. They've only got one pair of hands. So the investment of time, the investment into people will have a direct effect into the size of your program and the scale and speed at which that program builds. Your budget. So this is a budget including salaries. Again, there is no, you must have a minimum size, you must have a maximum size. You decide the investment you can afford and be prepared to support that team as it's delivering the work that you want them to meet. The budget is flexible. So there's so much flexibility, really. It's not like you're commissioning a new breast cancer screening service where you've got to spend at least £250,000 on a tomography machine and X amount of staff. You can start small, you can grow to where it needs to grow. You can fund it from your charity, you can fund it from other sources. What you do with that money, you can choose a program, again, that meets the need that's local. So you can work with the staff, with the public, with patients. You can work on-site, off-site. You can join up with local organizations. You can have a program that's regular, time slots. You can have a program that changes across the year. You have flexibility. So we've talked about how hospital arts, because they're sitting into health, one of the key senses of their value is how they support the health need. This is just a diagram that looks at what health needs look like from the person at the centre right through to government. These are the kind of main strategic aims that you might be looking at. For this webinar, we're looking at the impact on the individual. What does person-centred support through hospital arts look like? We look at the NHS plan. How can hospital arts help to support the population from babies right through to people at end of life? How can the hospital arts support the NHS people plan? And as Neil touched on, the wellbeing, recruitment and retention, satisfaction, control over that working environment. These are some of the reasons that help people stay in a job and feel that they have the capacity to survive the job. Outside of health, one of the priorities for Arts Council is shown in their Let's Create strategy, which is their participation aspect. And their statement is that by 2030, their vision is England as a country where the creativity of each of us is valued and given a chance to flourish. A country where every one of us has access to a remarkable range of high quality cultural experiences. What I find really interesting about this statement is if you were to take out the word creativity and the word culture and put in the word health, you don't really change the statement that much. The overlap between the health vision and the cultural vision for the country is pretty much identical, that we all have the chance to flourish, that we all have access. So we then skip some slides. So what you're really doing when you're commissioning hospital arts is you are bringing together the resources from health, the resources from the creative and cultural sector, and the resources from the community. And it's like you're almost applying 3 sets of resources to the set of needs that you're trying to fulfill. So you're really harnessing a huge amount of power by bringing in a hospital arts service. And here's where we take a lovely trip around the southwest. We're going to look at the range of work according to these themes of kind of priority, strategic aspects. So we've got anchor institution, which is the way that the Treasury sees how the NHS should use its public money. We've got patient experience, which is set by the NHS plan. How can hospital arts people help people to start well, live well, age well, die well? How can they be person-centred? We've got staff wellbeing, which is captured in the NHS people plan. And then we've got those local health priorities, including working with trying to focus on the people who have the least, those core 20% of the population, and the groups that are often overlooked by mainstream services. How might hospital arts help hospitals to breach those gaps? If you're wondering what on earth is an anchor institution, here is an explainer. It's basically that the NHS can make a difference to local people through using its money and its assets wisely. So how might hospital arts help a hospital to use its money for social benefit? How might hospital arts help unlock the use of buildings and spaces to support communities? Those same hospital arts programs are absolutely working with local partners. So how can that work help to spread that learning and good ideas back into the health system? The access to work and skills, how might hospital arts, through things like volunteering, work experience, student and university placements, help to increase the number of people seeing the NHS as a place to build their own personal skills? And finally, how are we able to make best use of that? The green spaces, how do we make sure that what we're doing isn't making our carbon footprint worse? How do we make the NHS feel like it's got more control over the way that it uses its assets. So we go back to Francis to give us a highlight, and then we'll hear from Gloucestershire and Dorset and Arcas. So I'm going to hand you to Francis to introduce herself. Francis, I will be following your click instructions.
Thank you. Good morning, everyone. I'm Frances McAdam. I'm head of the arts programme at University Hospitals Bristol and Western NHS Foundation Trust. UHBW, as we commonly call it. It's a very long organisational name. Thank you so much to Penny for that overview there, and thank you so much to Neil for the opening address. I recognise the strengths we have having the CFO as our creative champion, our arts champion, and the commitment of UHBW in terms of funding for our programme. It's not, it's a great responsibility to have to lead the programme, and with that support behind me, it's fantastic. And as Neil explained, when we talk about our work, UHBW Arts and Culture, we kind of split it broadly into 3 areas: spaces, people and partnership. And I'm going to talk a bit more about the partnership work that we do. One of the flagship projects that supports our role as an anchor organisation is the annual Western Arts and Health Festival in Weston-super-Mare that Neil briefly touched on as well. And as an anchor organisation, we exist to serve the people, places and communities of Bristol and North Somerset. So the festival itself was initially developed to celebrate the merger of Western Area Healthcare Trust and University Hospitals Bristol NHS Foundation Trust when they merged back in 2020. And the festival was really a platform as well to recognise Weston-super-Mare's long history as a place to visit for wellness. Our clinical strategy 2025 to 2030 sets out 4 priorities. One of those includes delivering Healthy Western, and that's the vision for Western General Hospital to be a strong and dynamic hospital at the heart of the community. The Arts and Health Festival offers a creative approach to this vision. There's many different things happening for Healthy Western, but this is kind of our real way of embedding the town and the hospital together, connecting the town and the hospital together. We produce the festival in partnership with a cultural organisation that are now called Superculture, previously Culture Western. And the purpose of the festival is to bring people together and to shine a light on that creative provision that exists year round in Western, that can support our patients, staff and local community in their own wellbeing. And through our collaboration with Superculture, we can tap into those year-round connections and reach out to the community and support those national shifts of hospital to community and sickness to prevention. The festival takes place at the hospital and in the town, further strengthening the connection between the two. And activity takes place in community settings in the build up to the festival. And the festival itself utilises the hospital and community assets, so the beach, parks, swimming lake, shopping centre, cafe, and that's with the aim to reach as wide a demographic of the local community as possible. So people are in spaces they're more comfortable with, they can access, and places that are free. The whole festival is free of charge, so you can, it's not that's not a prohibiting factor for people. The festival supports patient experience as it leads into and builds out to our year-round programme of activity that takes place at Western General Hospital. It also supports recruitment and retention priorities, as Neil spoke about, showcasing Western as a vibrant place to live and work. And it supports people in the community to take action for their own wellbeing. We know from last year's festival, a member of the community, it was the first time they'd been able to go out on a walk since pre-pandemic. And they came to many activities in the festival. And at the end, they spoke with one of my colleagues and shared how they'd made a personal action plan. They'd spoken with their neighbour and they're going to go on regular walks with their neighbour, enjoy the fresh air, enjoy those green spaces and blue spaces, and connect with somebody. So that was really inspiring, that this shining a light on what happens has connected people to kind of take their own well-being into their own hands and make a positive plan. Over the years, the festival has provided space to reflect and remember following the pandemic. It celebrated Western General Hospital colleagues, the diversity there, and creatively addressing issues of violence and aggression, as Neil spoke about. That exhibition also sits on the grounds of the hospital, so not just inside the hospital, it's outside as well. So anybody in the local community can experience that exhibition outside as well. We also celebrated and marked 75 years of the NHS, and last year we focused on the 5 ways to wellbeing. So in essence, through this partnership, we're better connected to the town and county councils, to funding partners, to housing associations, the education and voluntary sector, and we're all kind of working together to really embed creative health in the community. Also a note to say that the festival was funded by UHBW funds, our arts budget, our hospital charity. We've had some years where we've received Arts Council England funding and many other avenues of funding as well. So that's enough of me talking. And here is now a 2-minute film from last year that will give a real sense of Western Arts and Health Festival. Thank you.
This is the 5th year of a partnership between Superculture and Western General Hospital and the wider University Hospitals Trust, and the amount of lives that have been touched by some of the very unique and wonderfully fun events. But the fact that it engages, all ages and all communities. The hospital is very much a place that we want to be at the heart of the community and to be very much part of promoting health and well-being.
I was thirsty for connection, run dry. I needed a sign to take 5. It was hard to unmask, open my door to the outside. I felt out of touch in a street full of life, a headlong public dive, not knowing if I'd be caught, remembering how to talk, learning to spin old threads again. I learned it was fine to be 5 out of 10, or less. I was warmed by a medley of tea cozies, our mismatched patterns matched. I learned that pink high vis is my colour, that my local park is my friend. A child filled my cup with mint and brought it to me as a gift. I wrote my story on the tablecloth. I learned to lead myself on walks through the Mendip Hills inside. I ate in Love's kitchen. I was full for days. I vow to wear sparkles at every age unless they itch, and then I will simply sparkle. Sometimes I'll forget, run dry again, but I've tried this blend. I know this thirst can be quenched.
Frances, do you have more to add?
No, I think you've all heard enough about University Hospitals Bristol and Western NHS Foundation Trust for today. So I'm really looking forward to hearing my counterparts across the region talk about the various amazing projects that they've undertaken. So thank you.
Thanks so much, Frances. Anushka, deep breath, it's all yours.
Thank you, Penny. You're doing an amazing technical job, much better than I ever could. Welcome. It's really lovely to be here and celebrate all of the fabulous arts and health work that's going on in the Southwest and promote it. Here's a little snapshot. I'm the arts coordinator at Gloucestershire Hospitals NHS Foundation Trust. That encompasses 2 sites of Cheltenham General Hospital and Gloucestershire Royal Hospital. We have our invisible corridor that connects the two. This is a project that I wanted to bring along today that I thought was slightly different to some of the other projects that we deliver at Gloucestershire Hospitals. The project was called Submergence. We had the installation at both Cheltenham and at Gloucester. If you could go to the next slide, please, Penny. It was an immersive light and sound installation for both patients and staff. And it was a project that we were really, really fortunate to work in partnership with an incredible group of artists that are local to us called Submergence. They've actually, called Squid Soup, and this piece is called Submergence. So they do lots of different light, sound and technology pieces that they have exhibited all over the world. So there's millions of people that have seen this particular piece of artwork that is called Submergence, but they'd never actually exhibited it in a healthcare environment. So they came to me one day, asked if I'd be interested. Of course, I was extremely interested. And we worked together to achieve some funding for this project, which was very kindly given to us by Innovate UK. As it came from Innovate UK, it was going to be led as a research project, looking at how the technology could be used in a clinical setting, what the benefits were, if there was anything that, if they were to make this a permanent piece, that they could roll out in other healthcare settings, would there need to be development in their piece of artwork. And essentially, the main thing that we wanted to know from our point of view was, could having something, an experience like this in our hospital help to reduce NHS costs? When I say that, the costs that could be incurred are things like encouraging patients to attend their hospital appointments when they might not necessarily have done so previously. An example of that is that our, as well as having an installation in both the oncology outpatients, and also having at the same time one of their installations in the children's centre, just outside of their outpatients, so that patients and staff could use the artwork as they so wish to do so. We also ran some focus groups, and this was supported by our brilliant community support outreach worker, who invited some of our ethnic minority groups that we had already recognised as a hospital, were perhaps not coming to their appointments. They weren't. They didn't have that engagement that we wanted, so that we could support them. So she was absolutely fabulous, brought them along, and we ran these focus groups. It was sometimes the first time that they, some of them had even ever stepped foot in the hospital, which was a massive thing for them. They were quite nervous about coming. They weren't quite sure what to expect when they were there. Any engagement that they'd had from the hospital might have come in letters that they didn't quite understand. So it was quite frightening. And then to be presented with this absolutely stunning, immersive piece of artwork that they could really broke down those barriers. And we had some of our medical staff there as well from oncology and also in the children's centre that were there just to meet some of these members of the community and to break down some of these barriers, so that they realised it was a safe place, that there were ways that they taught us that we could change how we perhaps contacted them or made things more accessible. So as well as it being great for ensuring that appointments weren't missed and therefore these unnecessary costs being incurred, there was also feedback that we got from the research. For example, in oncology, patients creating their own care plans by one patient had radiotherapy that was booked every single day for 3 weeks, and towards the end of that was really struggling mentally to want to actually come into the hospital. So took it upon himself to come in 15 minutes before his appointment each day and just sit in this art installation and just collect his thoughts and calm himself before he had to go on for his treatment. Penny, last slide for this one, please. I just wanted to finish off as well by saying about the impact that it had on our staff well-being as well. So of course, the artwork is there to be enjoyed by the hospital, by the staff as well as the patients. And the one really lovely comment that we had from an oncology member of staff said that even 30 seconds or a minute, you glaze over and experience the sound, the separation from your day. It really makes all the difference. Having some time to turn off your brain and reset and refocus is invaluable, which is really lovely. This particular member of staff said how hard it can be delivering bad news and then having to go in and refresh yourself to speak with another patient. And so just having something like this in the hospital gave them that opportunity to remember that their well-being matters just as much, and how this can impact on our patients. I could go on about it forever, but I'm aware of time.
I'm going to have to stop you. We need to get lots of more information in. Thanks so much, Anushka, and well done. Our next person is Susie. Susie, do you want to give us a quick minute on the Anchor Institution work with your local arts university?
Hi there. Yes, absolutely. I'm Susie Rushbrook. I am the Arts in Hospital Manager at Dorset County Hospital NHS Foundation Trust. I'll be talking to you later on, but I'm just going to give you a quick snippet into a project that we did in collaboration with the local arts university in Bournemouth. So we had a project where we needed to quite swiftly turn what was previously council offices into a new outpatient assessment centre in the centre of the town of Dorchester. We worked with the interior architecture course at the university, and we presented them with a brief of what we wanted in terms of orientation and wayfinding within the building, and they then presented 6 proposals to all the relevant stakeholders. We selected the most appropriate project, and the students then collectively worked that up to a final version that was ready for production. The students were then invited in to witness the installation of their final project, providing them with what is real life work experience, which is incredibly valuable. This project has led to us collaborating with the university more. They've developed their course to include designing for healthcare, which is really important. And on top of this, we also engage with the local young offenders groups here and Weymouth College, so we really are reaching out to those community settings within our county. I'll leave it there. Thank you.
Awesome. So the slides will be available afterwards. I'm going to leave the details of ArtCare's work. In my other role, I work for ArtCare, so I know that I have permission. I can give myself permission to skip this one to save us some time. We'll put the details onto the Southwest resource pack so that you can follow up on this piece of work that looked at working with the VCSE for older people in the community. So we're moving now to patient experience. We're going to have Hetty coming next, talking about their very large scale capital build, and then we've got a smaller retrospective build from Southampton. Gloucester, I think it's okay with you, Anushka, for us to leave the slides for people to read at their own time to get back some time, and then we'll go back to Susie to hear about the accessible collection. So kicking off with the fabulous Hetty, thank you so much. Here comes Bath.
Next slide, please. Thank you. Hi, everybody. So I'll be presenting the art commissioning for the Dyson Cancer Centre, which started commissioning for the artworks in 2021, and the Dyson Cancer Centre opened in April 2024. I won't be presenting the interior design slides from the Architects Arcadis today, but these can be viewed in the resources section of the Southwest Creative Health webpage. Along with the interior design, the 11 art commissions provide rich representation of nature throughout the centre, shaped around a land, water and sky theme. connecting with nature, also known as biophilia, generates an increase in positive emotions and feelings of calmness and optimism, and can help lower anxiety. Next slide, please. So I'll just go through the building quickly to give you an idea of the layout. The first of the 3 slides with the floor plans, this shows the ground floor level. So the bottom right-hand corner is the main entrance, which takes you into the atrium. Then you move up through the centre to outpatients and the consulting rooms on the opposite side, and then up to radiotherapy, and then across down to the link corridor and the medlock unit for chemotherapy. And then on the first floor, we have the inpatient ward. This has a 22-bed facility, and it has its own courtyard for patients to go and spend time outside. And there's also a light well which looks down onto the lower ground courtyard. The area over to the left, the link, is staff facilities. And then on the 3rd floor, we have in the link section, clinical imaging and measurement, and then over to the right, the nuclear medicine. The image below shows the Green Heart Garden concept. So when the old facilities are demolished, they will create a beautiful new garden, which cancer patients can enjoy, but also there'll be a section for wider public to go to. The corner area here with the glazed artwork, this is the Macmillan Wellbeing Hub, and you can see this on the corner of the building as well in the main picture. And this spreads across 3 floors of the cancer centre. The hub is a non-clinical calming space where patients, family and carers can receive practical and emotional support and living well with cancer. Next slide, please. So here we see the main atrium, and we have lovely acoustic paneling in wood, and also boards that go all around the side of the building. So the acoustics are very good in this area, and so you arrive and it feels quiet and calm and spacious and lots of lateral light. We commissioned Mark Sands to create this mural, Bee Eaters in Olive Trees, which is 5 meters tall. It's on canvas, and he painted this in Portugal, where he now lives, and inspired by the olive trees that surround his small holding over there. He then rolled up the canvases and brought them over, and in a big scissor lift, it was all installed. So it is actually hand painted rather than digitally printed. Then on the right-hand side, we have a painting by Deirdre Dyson, which was donated by the artist, called Bulrushes. And again, this fitted perfectly with our theme of land, water and sky. And in the middle, complementing and holding that space in the middle of the room, is the beautiful design by Kate Bond of the Phlomis plants, which is printed onto a Corian type surface. And then there is backlighting, and it makes a really welcoming site when you walk into the centre. Next slide, please. And here we have the ambient room, which is also in the atrium. It's a room that you go into just 2 or 3 people at a time. And we commissioned the artist Crystal Lebas to create this hour-long film on a loop of a bluebell wood near Marlborough. From dawn until dusk. It's specifically created to offer an immersive experience of a bluebell wood in the spring. And it also sort of gives the patient, family, carer a phenomenon of a bluebell wood, whilst allowing time to detach away from the day-to-day clinical environment. This space creates an atmosphere of tranquility and calm, providing a place of refuge and contemplation. Next slide, please. So this is the Macmillan Wellbeing Hub that I referenced earlier. We have the ground floor, which has the information and support hub, psychological support room, quiet rooms. It also has a hairdresser, advice like dietetics and benefits. It has a lymphedema treatment room and also beautiful relatives accommodation with 2 bedrooms and their own kitchenette. It's a non-clinical area, so we were allowed to sort of bend the rules a little bit in a clinical setting that is normally the case. And the artist, Natasha Clutterbuck, was able to paint directly onto the walls, which is really a first for us in the hospital, I think, especially on a scale like this. So there are 13 murals across the 3 floors. She's a Somerset-based artist and specialises in painting vegetables and plants, and artist in residence at Yeo Valley Organic Farm. She was commissioned to paint these murals about a year before actually starting on the work. She uses natural pigments, including red iron, yellow ochre, mud collected from around her home. And she says, I like the way that using it in my work connects the subject matter back to the earth. Next slide, please. So as part of the consultation process and working up the designs for the murals, which were all free painted, so she did a lot of studies beforehand to make sure that she got her colours and designs right, and sort of bringing in the pollinators and the watery edge of the forest, and so bringing in different insects was all considered. So we held 2 workshops for patients and Macmillan nurses, and they helped to work up the first drafts in the first workshop, and then took part in some very therapeutic and enjoyable drawing sessions with Natasha, working with the plants that were in the centre of the room. And then at the second workshop, she brought back her worked up designs, which they all loved. And then they carried on with another session. Most of them hadn't done any painting since they'd been at school, or very little. But I think what they produced was fantastic. And they also got a real sense of Natasha and her work and how she wanted to impact the Macmillan Wellbeing Hub. And we've had really good feedback all the way for this one. Next slide, please. So the ground floor courtyard is in the outpatient area that I referenced earlier. It's a non-accessible area to patients or public, which meant that we were able to put something in there that didn't have to worry about slips and trips and all the rest of it. So this is a light sculpture called Time and Again by Bruce Munro, who's a local artist and has done a few things for us in the past, and a great supporter of Art of the Heart. He uses the lily format as a visual reference, which was inspired by visits to Chatsworth House with its lily canals and glass houses. And also he's very interested in the concept of time. He's Australian, and he looks at the Aboriginal concept of time as circular rather than linear. I'll move on to the next slide now, please. This is the outpatient area next to the courtyard, and this is a series of works by Lisa Todd, who is also an artist who lives between Bath and Windsor. She's South African born, and as you can see, her designs are very vibrant and beautiful and joyous. During lockdown, she had the idea to send her designs to community of beaders that she knows in South Africa near Cape Town, and they translated these designs into very fine, intricate beaded artworks, and then those were sent back and put into frames and came to the Dyson Cancer Centre. The only wall space we had in this huge room were the columns. So the fact that these are vibrant, but also when you go up close to them, they're incredibly intricate, really hold the space well, and also complement the furniture very well as well. Next slide, please. Then we move on to the Medlock unit for chemotherapy, and the Green Heart Garden series by Kate Bond. She worked across 3 areas in the cancer centre, the reception desk, which you saw, and then the Medlock unit. And the Green Heart Garden is going to be the garden that we'll have in the future. So this this Medlock unit looks out onto what will be the garden. So she wanted to bring that garden into the treatment areas, and all along the length of the back wall, which is about 50 meters long, she designed these digitally printed artworks, which are printed onto sort of wall panels, which meet all the infection control standards and are extremely hard wearing as well. There were also 5 single treatment rooms and a subweight area as well. Next slide, please. Then we come on to the radiotherapy area, and this is a beautiful light box by Amy Shelton. And this came about really the connection between health and environmental well-being is what Amy's extremely interested in. She used flowers that were sourced from the Hauser and Worth garden in Bruton, the Piet Oldolf garden, which was very kind of them to allow her to send several trips up there to gather many plants, which she then brought back to her studio, dried for several weeks at a time, and then went through the very painstaking process of dissecting and then replacing onto to create this beautiful image, which you can now see sitting in the waiting room, all finished and looks stunning. The next slide, please. This just shows the inpatient ward, which has 22 beds. The 10 single rooms all have views out to big views outside. You can see across to the Lansdowne Hills from this image here. And then on the other side, they'll look down onto the Greenheart Garden when that's completed. It has quiet rooms. It also has a very roomy sitting room and dining room, which leads out onto the inpatient courtyard. The artworks that you can see here are also by Kate Bond, so that's her 3rd commission. And there are others in the corridor. So we'll just go on to the next slide, please, which takes us into the corridor, to the courtyard, I should say. And these are bronze swifts by Hamish Mackie. It was an incredibly interesting and complex and long lead into this commission. Started at the time we started the commissions, and the swifts were actually crane lifted into the courtyard in May 2023. So they did arrive sort of like bang on time when the swifts should be coming to the UK, which was a nice sort of synergy. But we visited the artist studio. We went to Limpley Stoke Mine to choose the stone plinth, which was donated by the mine and is 250 million years old piece of stone. And we went to the foundry in Banbury to see the casting process. So we just got a really sort of like rich, layered experience of the whole commission, and it's been very well received by the patients. Next slide, please. And this takes us up to clinical imaging and measurement on the 2nd floor. The team were very keen to have artworks that reflected their practice, so imaging. And I happened to come across through Crystal Labar, who's one of the artists in this, about an exhibition called Seedscapes Future-Proofing Nature, which was curated by Liz Wells, a photography scholar specializing in landscape and environment. Most of the works here are from that exhibition. And then Heidi Morstang, so we had Heidi Morstang, Crystal Labar, and Dorneith Dougherty, who's actually from the States. Heidi Morstang made a couple of pieces, new pieces, especially for the department. And the one that you can see on the top right, Landscapes of Deep Time, Bath Ammonites, was inspired by several ammonites estimated to be 200 million years old that were discovered during excavation of the cancer centre site. Heidi examined tiny fragments in a scanning electron microscope. She then created a cyanotype, one of the earliest photographic processes dating back to 1842. So I'll just whiz through that. You can see more about the whole exhibition. If you go on to Seedscapes Future-Proofing Nature, you can find out more. Next slide, please. And then finally, it was a huge community and sort of supported project. The fundraising spanned over about 12 years, and the charity RUHX raised £10 million. We also had funding from Macmillan for the Wellbeing Hub and the Department of Health and Care Social Care's new hospital programme. All the artwork and interior design features were chosen in consultation with staff and patients during the 2.5-year consultation and planning period. And there's a nice quote there from our patient representative, Steve Rose, who was on our regular arts committee, which I shall leave you to read at another time. Thank you very much.
Thanks so much, Hetty. For those of us in the presenters, we are going to try and keep as much into the session as we can. We are at danger of running over otherwise. So we're going to, having just heard from Hetty about that very large scale capital build, we're going to hear now from Southampton on the two aspects that they use in terms of patient experience, because it's not always about the environment. So Neda, it's over to you.
Thank you so much, Penny. Hello, everyone. I'm Dr. Neda Mohammadi, the Art Curator for Southampton Hospitals Charity. At Southampton Hospitals Charity, we are committed to enhancing patients' care at University Hospital Southampton by funding projects that go beyond standard NHS provisions. Our art program has been running for 2 years and almost half, and during this time, it has grown significantly, becoming a key part of our support for patient and our staff well-being. Next, no, that's the correct one. One of our impactful projects has been the complete refurbishment of mortuary viewing rooms at Southampton General Hospital. This initiative reflected the charity's dedication to supporting the well-being of carers and grieving families. Next slide, please. Thank you. The projects involve construction work, furnishing both the adult and children's viewing room, installing artworks, and designing the interiors. We collaborated closely with the mortuary and trust estate team to bringing these projects to the life. In the children's viewing room, we included 4 colorful prints complemented by a mural painting inspired by one of the artworks. The adult viewing room featured another mural and a bespoke light box created by Nature Works for Health. In the corridor leading to the viewing room, we installed soothing artwork donated to the charity, and additionally, we had 2 ceiling panels added to each room to brighten and uplift the space. Next slide, please. This refurbished viewing room aimed to enhance the overall experience for grieving families by addressing both practical needs and emotional support. Features like improving lighting and enhanced accessibility ensure that all visitors, including those with disabilities or mobility issues, can comfortably spend time with their loved one. As a part of our commitment to evaluation, we conducted a post-evaluation, and the feedback has been overwhelmingly positive. Here are some highlights that you can see. 79% of respondents rated the appearance of the viewing room as very high. Next slide, please. And here you can see some comments from our visitors that we gathered from our questionnaire forms. Next slide, please. Another project that we run is from the beginning of 2024, we launched 2 series of workshops tailored specifically for older patients and patients in dementia ward. Next slide. Thank you. These workshops are held every other week in activity room within their respective wards and are open to all patients. We have partnered with Southampton City Gallery, whose learning and education team works closely with us to design and deliver a meaningful and engaging program. Next slide, please. Art workshops in hospital play a vital role in improving the emotional and cognitive well-being of dementia patients and older adults. These creative sessions serve as a therapeutic outlet for self-expression, help reduce feeling of isolation, and simulate memories through tactile and visual engagement. They provide a sense of accomplishment and purpose, encouraging social interaction while also helping to lower anxiety. By creating a joyful and calming environment, these workshops significantly improve the overall quality of life for our participants. Next slide, please. To ensure our services continuously improve, we gather feedback and conduct through evaluation with participants and their families and our staff. Based on the finding, you can see 83.3% of participants rated their workshop experience as excellent, and the remaining 16.7% rated is as good. When we asked how the workshop impacted mood and well-being, 77.8% gave us 5-star rating, while 22.2% rated is as 4 stars. Can we go to the next slide, please? We have also gathered some wonderful feedback from patients and their families and our staff member, which highlights the positive impact these workshops have on their lives. For example, a family member said, "Lovely to witness self-expression through art, especially with dementia patients who were clearly engaged in what they had to draw." A patient said, "Everyone was happy. It was good to give it a go. It surprised me." Thank you so much, Penny.
Thanks very much. So again, we're hearing from Southampton that it doesn't have to be a large scale environment piece that's the only option. You can retrofit in previous rooms. You can start by just creating those partnerships and great patient experience happening at the bedside or on the ward. We have got in the slides, which we will have available online, the details, because so far we've heard from an acute NHS trust, and we've got lovely information here from Anushka, which is around a project that's in mental health crisis rooms. So it's a different sort of healthcare setting, and we will make this information available on the online resource so that we can get back some time. We don't want you to miss out too much. So apologies that we're showing you slides only at this point, and we'll hear more detail from Anushka. We're going to hear from Susie in Dorset next.
Hi there. I've already introduced myself. I'm in Dorchester in Dorset. A quick image check. Behind me, we have our temporary exhibition on display, and it's by printmaker Jeremy Speck, who is an Exeter-based artist. We change over our temporary exhibition corridor 4 times a year for the benefit of our staff and patients. We are fortunate enough to be one of the longest running arts programs in the area. We have been going for just over 35 years now. Back in 2022, we looked at how we might celebrate the 35th anniversary of our program. And so we decided to produce a user-friendly map that came with an accompanying booklet that told the stories of 35 pieces in our collection and how we came to have them. Next slide, please. You can see there's a snapshot of some of the pages, and they have details about the artists or how we come to have the work in our collection. A lot of our collection is based around our local environment or our hospital itself. Our environment in Dorchester is our greatest asset, and it's easy for our patients and our staff to relate to work that focuses around this. Next slide, please, Penny. In 2003, we partnered up with Active Hospitals to adapt our map and create a walking tour of our art collection. Detailed on here are differing lengths of walks. They're marked out with their distances, their steps, and these distances are then referenced to local landmarks such as Weymouth Esplanade, for example. But what we see here is a demonstration of how we are diversifying our collection. We are making it more accessible by sharing it in ways that are clinically beneficial, as well as just being beautiful things on the wall. Next slide, please, Penny. We then went on to collaborate with a local organisation called Screenplay, who specialise in audio projects. Again, trying to make the collection even more accessible. Screenplay took 22 stories from the map and created an audio story that you can listen to on your mobile phone or on a tablet. As I've mentioned, our collection very much focuses on our local area. So the artists involved in creating this went to our Dorset beaches, they went to Summer Fates, they visited Mr. Punch, and they even went to the top of the Cerne Giant at dawn on a May Day to listen to the Morris Men. So all of these little audio snippets have been captured and are now you are able to listen to them from anywhere, but specifically from a hospital bed if you are unable to get out and see the collection. So the idea is to make the collection accessible, as I've said, and that's about it really. The app is designed to be very easy to use on your smartphone, and it's very much like a podcast or BBC Sounds or something like that. You can access it via a QR code, and these are on display around the hospital and labels attached to the particular images. Here you can see the Damien Hirst Rainbow Butterfly, which was a huge project that happened within COVID that benefited NHS Charities Together and all the arts programmes in the country. There is also a picture called My Big Nurse, which is an exhibition by a Bristol artist called Zena Box that we had on during the pandemic, and staff were able to vote for their favourite piece of work, and the charity then purchased a print of that piece of work. So this image, My Big Nurse, is now on permanent display as part of our extensive collection. I'll leave it there. I don't know if there's a little audio clip or not. I'll leave that with Penny, but I'll sign off for now. Thank you.
Thanks so much, Susie. The audio clip, you can, once you see the slides in the resource pack, which will go up tomorrow, when you click on this icon, you can listen to the audio clip of this particular artwork, and you can also see the art map on the link here, which takes you to the website for Dorset County Hospital. Again, thank you, Susie. That was terrific. We've got we're going to try and skip through the last two here under staff wellbeing and see if we can squeeze in some time. We might overrun slightly to listen to Cornwall, but we have Poetry Machine and Somerset describing now their staff wellbeing.
Thanks, Penny. So hello everyone, I'm Lisa Harty, I'm the Art and Design Manager at Somerset NHS Foundation Trust. I head up the Art for Life team, which is the Trust's art and design programme, which was established in 2013. So, sorry, 2013, that's when I arrived, 1993. So like Susie, we're one of the oldest teams in the country. We're a small part-time team and we sit within capital projects, which, as Penny alluded to earlier on, you know, a number of teams sit in different locations across trusts. Our programme, like you will have heard from everybody else, is so much more than just the artwork on the walls. We have an exhibitions and collections programme, we have our participatory programme, and we have what we call our environmental programme. The thing that I'm going to talk to you about today briefly is a staff wellbeing project, and I'm going to show you in a minute, or Penny is hopefully, a short film that comes from a project that was created marking the 75th anniversary of the NHS, and it was developed with other fellow hospital teams around the country that are members of the National Arts in Hospitals network. And in Somerset, we wanted to use poetry to explore staff experience. And we worked with the poet Beth Calvert and her poetry machine. And Beth set up in the really busy canteen areas of Musgrove Park Hospital in Taunton and Yeovil District Hospital, and engaged with the staff on their breaks. And if Penny is okay to, if we could just maybe join the film at about 1 minute in, and that'll give us a few minutes. Just while she's doing that, the other thing to say, which is quite unique, is that our trust covers not only acute sites, but mental health and community sites as well, having merged with Somerset Partnership and with Yeovil District Hospital. So we cover the whole of Somerset.
Thumbs up if you can hear it, Lisa.
Today we've got a poet in residence for the day. It's part of a wider project collecting and gathering stories as part of the 75th anniversary of the NHS. So the poetry machine is a way of taking people's words, thoughts, ideas, and she's going to type them up in an old-fashioned typewriter, which I just think is very engaging, and it takes the pressure off people who might be a bit sceptical or scared about creating a poem themselves.
My name is April Cousins and I work as a knowledge and evidence specialist in the library of YDH. I visited the poetry machine where the resident poet Beth spoke with me and had a lovely friendly conversation for 10 minutes. Then she sat and wrote a poem about me on the spot and about what we talked about, which was lovely. Cardigans, created with April. Of course, we've got to have our cardigans, you say. Libraries are a place of safety, inclusion, nothing to pay, just books to take away. Your job is not about holding books close, my precious, but giving, sharing what you know. It all comes back to the personal. Libraries held you at school, then as a mother, and now when you're trawling through databases, it's the thought of the patient with the pressure ulcer or with early onset dementia, like family members you've known up close, in your small way, pulling the cardigan of knowledge home.
That was amazing.
It's biryani lunch breaks, created by Pushpalata and Reshma. This is the best ward in the trust, the busiest, but nobody stays back alone.
Everyone's walk out together when she arrived 3 years ago.
You gave her the Tupperware box of your knowledge, 20 years of wisdom.
A mentor and a mother on the wall.
Breaks together spent sharing food, your biryani, her favorite.
Her recipe is still learning. You have opened the gate.
And given her your spice.
Any passing comments for us, Lisa?
No, I'm happy to bearing in mind the time to let somebody else speak, but thank you for that opportunity.
I'm aware that we are running over. For people who are able to stay on, I thank you so much, and apologies for people who have to go. Alexis, if you can let me know if we're okay to continue to record. We've just got 2 more to get through after this. And I'm going to return us back to the main slideshow. We've got Laura next to talk to us about the staff engagement and major work going on for one of our newest hospital art services down here in Dorset.
Thank you, Penny, and thanks everyone. What amazing, inspiring programmes going on all over the Southwest, which as an early Arts in Hospital programme really aspire to and get a lot of inspiration from. So I'm Laura Joy, I'm the Arts Manager, University Hospitals Dorset. As I say, our Arts in Hospital programmes is a little over a year old. It was initiated as part of a major transformation of our trust. Our trust is Royal Bournemouth, Poole and Christchurch Hospitals, and my role is funded by the hospital charity. Our new hospital project, you can see an image here with our brand new beach building, is a key aspect of the transformation. It sees us Bournemouth becoming the emergency centre, Poole the planned care and Christchurch specialist outpatients. So the planning conditions for the new build actually stipulated our very first art projects, including this one, which is a public artwork for the exterior of the new building. So I'm going to very much do headlines on this project, skim through it very quickly. So you can see the architect's impression here, and this is the front cover of a brief which went out to artists in May last year. Now we had 48 responses. Next slide, please, Penny. From regional artists. So you can see that our aims for this artwork were that we wanted to champion arts as a key aspect of hospitals, form the focus point for an arts trail, very similar to the one you've seen from Susie, who in our Pan Dorset sort of art strategy, we support each other and get a lot of inspiration from each other. Linking to other art initiatives across the hospital, such as the participation projects that you've seen examples of, which we're starting to generate as well, and also creating a sense of welcome and improved well-being. So it really does fit into a lot of those pillars, really. So as I say, we got 48 responses for this piece on the beach building. Throughout the following month, so June and July last year, those artists were long-listed to 10 and then shortlisted to 3. A range of NHS staff and local cultural representatives took part in that, and there was an online poll. So over 300 staff and NHS stakeholders took part in that. And the artist and all the questions that were raised by staff and public formed the basis of the artist discussions, or interviews you might like to call them, and the artist was appointed in summer 2024. And then the next slide, please. Engagement events. Sorry, this was our creative concept from the coastline to the forest, which is based on our interior design strategy as well, and also shapes our art strategies. So the engagement events took place in October and November. So it's really been quite a long process to make sure that staff were really involved in making decisions about what this artwork would be in their workplace. We've got 10,500 staff at UHD, so it was really important to get everybody engaged. So the artist, we did a number of workshops. We did a Meet the Artist event as well, which was open to all. The workshops were open to staff and patients. You can see that there's, as well as some images of the images that were generated there, there's also some quotes. The phrase "everything resets" here at the bottom is something that came from staff feedback about the landscape of Dorset, how when you are out by the sea or when you are out in the Dorset landscape, everything resets. Your stressful day, your stressful job, those 12-hour shifts that our staff so often work, just resets. So that's something that's being really used as the artist, as sort of like the guiding theme of the artwork. We also, next slide please, did, as well as these practical workshops, did some public and staff polls. So down in the bottom right there, you'll see that people named their favourite or most important sort of landmarks or landscapes that they go to or that are really important to them. That formed the starting point for research of those places for the artist. And also we did some public polls and some staff polls where we had questions on material, technique, process and style. So we showed some examples of the artist's work, and then we got some feedback, and we got some really useful feedback, such as, you know, that a large percentage there, almost half of the people that took part, wanted it to be sort of bright colours. So the artist has taken all of this feedback. There was a lot of it, and is now developing a design direction, has developed a design direction. There's a list here on the left of all the staff, where all the staff came from across the hospital that took part, as well as, you know, including the staff from that beach building where this artwork is going to be on the outside of. So I hope that gives you a bit of an overview. Our designs are coming in early February. We're all very excited. They're going to be shared widely as well. But this design direction was shaped directly by staff to, you know, give a sense of ownership for that artwork that's going to take place, and also this sense of belonging and retention that is really, really key for the NHS as well. Next slide, please, Penny. Okay, I'm going to let you look at this project on your own. I think we'll skim through this one, but it was lovely. This is more of a participation project for staff. This was for the maternity staff. 500 plus maternity staff were invited to take photos and submit them, and then the top ones were voted on. And the amazing thing is that over 700 people voted for their favourites, which is a really amazing bit of engagement there. So on the final page there is a photo of the celebration and the winners of that first phase of the competition, and how engaged those staff members were and how excited they are and feel really positive to have their images up in their working environment every day, or images taken by their team and their colleagues. So I think I will leave it there. I will say, though, that this is one of many art projects that are being developed at University Hospitals Dorset at the moment, very much with the staff at the heart. And I'm really excited about what's coming from the artists soon. We're all really excited to see the designs and the other projects that are in the pipeline. So I hope that this reveals to you how our art programme, already still very young, but how it's sort of already started to contribute to staff engagement, to patient satisfaction, and to contributing to our hospital as an anchor institution. My email's here. I'd love to hear from you if you've got any input or feedback. And thank you for listening.
Superb. Thanks so much, Laura. As we heard from Bristol and Western earlier, we know that, you know, staff wellbeing is part and parcel of many of the hospital arts services. So again, I repeat my invitation to anyone who's watching now that please do get in touch and ask us more about all the program that you're not hearing about that is actually going on simultaneously to some of these bigger projects. We're very short on time at the moment, so I'm going to take an executive decision, and we're going to keep these slides as available to you on the internet. There's a terrific film from the team at
Somerset.
Art for Life. Yes, sorry, Art for Life again. So the link will be in the slides. So I'm sorry, Lisa, that we need to steal some time away from you. Art Care, I will make sure that the information on the Art Care team and all their program is available on the slides too, because I'd like to go to the organization that's almost in the most embryonic stage. We have all, so whether it's Art Care with 31 years, it's Dorset with 35 years, it's Somerset with 38 years, we've all started somewhere, and let's hear from Kathy in Cornwall about where they're at the moment in terms of their hospital and arts. Have we still got you, Kathy?
Sorry, I'm on two screens. Can you hear me now? Yeah?
We've got you.
Hi, yeah, sorry. I'm Kathy English, and I'm a psychiatrist actually working in the early intervention in psychosis team at Cornwall Partnership NHS Foundation Trust. Our trust provides community and hospital-based physical, mental health, dementia, children's and learning disability services across Cornwall and the Isles of Scilly. And as Penny was just saying, we don't currently have an arts service, but as a trust, we do have an aspiration to embrace nature-based and creative approaches alongside traditional care and treatment. And we now have a working group looking at how we might be able to establish an arts programme that could support this aspiration in becoming a reality. Can I have the next slide, please, Penny? So despite the fact we haven't had an arts programme, there have been a number of projects that have been delivered over the years through partnerships with our creative sector in Cornwall. And I've been involved in several projects where our early intervention in psychosis team has worked with individual creative practitioners and organisations. And these projects have offered patients and staff together opportunities for engagement with arts and culture. For example, we would regularly attend knee-high theatre performances as part of one of their community programmes in venues across Cornwall, often with creative workshops or meeting with some of the cast before a show. Another example I've got on there is where a group of us were learning about stencil street art techniques as part of a Black Cornish history project. And I've seen firsthand, as a clinician, the benefits for both patient recovery and staff wellbeing through being able to engage in these opportunities. Sometimes our team have raised funds for these projects, but often we've linked with programmes that have arts funding and a remit to reach these overlooked or hard to reach groups. If you could go to the next slide, Penny, I'll just talk about some stuff that we've been doing over the last year in the early intervention in psychosis team. And we successfully applied for some community arts funding to work with an organisation called Red Ruth Press. And they delivered a couple of screen printing workshops. And together, staff working in the team and people accessing care from us created a series of posters that illustrated things people have found helpful in terms of their care and their own recovery. And we've also been establishing partnerships with several local art galleries as we're in the process of setting up regular group gallery trips. These have been really popular, and I'm hoping that we're going to extend this work with other galleries and museums over the next couple of years. Can you do the next slide, please, Penny? So far, I've just been talking a bit about the work I've been doing with the early intervention in psychosis team. But over the past couple of years, Cornwall Partnership Trust embarked on a really ambitious project with the amazing arts and mental health charity Hospital Rooms. Some of you may be familiar with their work, but Hospital Rooms commissions artists to produce artworks for installation in NHS mental health units. They also run a digital art school, which offers free online workshops run by artists who have worked on some of their projects. Now, on the Cornwall project, Hospital Rooms commissioned 12 artists to create artworks for our inpatient mental health wards in Bodmin and Redruth. The project was largely funded by our estates team. Most of the artists were living and working in Cornwall, and some were invited by the Hospital Rooms team, and others responded to an open call, sorry. Now, the image you're looking at the moment is actually an artwork that was installed at Springfield Hospital in London, but I'm going to ask Penny just to, for the last bit of my presentation, just to run through the slides, which you'll see there's a series of slides showing the final artworks that were installed on our wards. And as part of the development process for these works, the Hospital Rooms led by curator, if you just keep running them, Penny, because there's a few to get through, thanks, Anna Tester, they set up a series of participatory artist workshops for the inpatient and community groups, and these were delivered on the wards at Tate St Ives and into Bodmin Arts Centre. And the team also facilitated consultation meetings with staff and patients on the wards. These artworks have now all been installed, and they've completely transformed our inpatient spaces where they've been installed. And they're also offering a range of opportunities for staff and patients to engage with art on a daily basis. I'm going to finish now, but if you want to learn any more about the work that Hospital Rooms do and more detail about the artists that worked on this project, then you can check out the Hospital Rooms website, which is hospital-rooms.com. Please go there and have a look at that for more information. Thank you.
Kathy, thanks so much.
Okay.
So as you hear, you can make the most of partnerships. You can have your own in-house team. You can have an ambition. Overall, we've hoped that we've been showing you that, as well as just being a point of care, a hospital is, using public money to help raise, collaborate with its own community. It's a place to learn, it's an employer, and because you might then bring in either creative projects or ideally set up a hospital arts service, you then turn that hospital into the opportunity for it to be a creative organisation and a cultural venue too. So you're really harnessing the power. If we think back to that Venn diagram that we saw earlier, I'm very aware that we have run over time for you and that many people may have had to skip off. So I'll just go through these last couple of summing ups, and we'll just make sure that if there's anyone with a burning question in the room, we can answer that in the last 5 minutes of extra time. I feel like we're at the FIFA World Cup finals. We're in extra time now, going for a golden goal. Hospital arts are more than a nice to have is our kind of key message here, and that they're this essential part of the infrastructure that brings knowledge, skills, resources, communication, collaboration into health, as a result of being brave and bold enough to add an alongside service to all that clinical care that's happening, whether that's acute or mental health. Hospital arts are capable of bringing in some of those local, regional and national health strategies, whether that's for the population, whether it's for patients, whether it's for staff. One gap that we currently have is that because hospital arts aren't directly linked to NHS England and they're not directly linked to Arts Council England, the value of that work isn't currently reported upwards into those big institutions. So that is a piece of work that we'd love to find partners to help us do that. That's just the paragraphs that just explain what I've just talked about. And I think here is where we ask the audience to think about what could you do to support. We've seen from the difference between where Cornwall are, where Dorset are at, and how can they get to the same place that Somerset, Bristol, Wiltshire, Dorset, Dorchester are at. And it's about that organisational support. Neil touched on that longitudinal approach. the ability to take the dots, which are the projects, and learn from them, to join those dots up and build in, you know, responsive and quality improvement, requires support over a longer period than just the 12 months. So you can, of course, continue to just do ad hoc projects, but you have to ask yourself, what are you missing out on when those projects come to an end and that skill and knowledge dissipates and goes back out into the wild? What is the benefit of having a service that continues and builds the learning into each next project? A commitment to partnership. Again, Neil mentioned that it went from being an individual person with a passion to bring it in, through to being a hospital arts policy, through to being almost a board mandate, having it in those strategic documents, making sure that funding could be ring fenced so that you're not constantly putting your teams through a kind of boom and bust situation where they have to permanently apply for core funding just to be available to take on those next projects. The importance of having leaders who will stand and face those daily mail moments and say, this is a worthwhile and valuable addition to our hospital because ... insert brackets, you know, what, describing all the hospital strategic aims. Practical support. So it's about allowing the work to be shared, having a portal that people can look it up. It's about finding ways to report that data and evaluation. We've learned from so many projects about how they're capturing the data anyway, but is the healthcare system allowing that data to get any further? Is the Arts Council opening channels that we can actually capture the number of live music hours being delivered in hospitals as opposed to concert halls? Is anyone willing to listen to the data that we already have as hospital arts services? Funding and match funding is always welcome. It can be the difference between having to tell patients, staff, public that the work has to stop and, you know, see that ground gained retract again. We've already lost, for example, the hospital arts service in Derriford and Exeter over the years, and the same for St Mary's on the Isle of Wight, whereas other services, systems have seen the benefits and are putting time and energy, like Cornwall, like Dorset, into building up their own projects. So we've got this gap. Remember that map at the beginning. It could be something as simple as an organisation giving over a space, remembering that a disused or underused building that would cost a fortune to get up to clinical level, we don't need as much expensive capital input to get that to a usable, safe, inspiring, creative space. Training and education is a gap that we still have. How amazing would it be if learning about creative health was part and parcel of all those new intakes of healthcare staff coming in? What about if the national databases could actually capture the number of hours delivered in hospitals and understand the number of organisations who are connected into hospitals who are delivering creative health in their communities? The work is happening, but is it being measured? These are gaps that we have. A reiteration, if you want to get in contact, you want to ask questions, you want to look up more information, these are just 3 of the resources, and you can email us. The details are in the chat, and for anyone who's booked in through the pre-event booking, you'll get an email again that just repeats some of these questions. And it leaves me now just to say thank you so much to everybody who's presented. Apologies for the projects that we couldn't show in detail. Any comments coming in from people or things that our presenters would just like to say as a passing sentence? This is your moment before we finish for the day.
Just thank you, Penny, for pulling this together and giving us a platform to be able to demonstrate what we are all so passionate about.
I'd echo that, Susie, and I'd add that the strength of our work is our partnerships with each other and our partnerships inside the hospital, outside the hospital. We are all here to make a difference to the communities that we serve, and I hope this morning has really demonstrated that to everyone.
Penny, there
can
was
see.
a question from the audience.
Thank you,
Just to
Alexis.
Hetty, saying, how
Mm.
does the hospital go about commissioning artists? Do they have a national call out? So don't know if you want to answer that question or not.
I could answer that question briefly now. For the Cancer Centre, because we had a strong theme with the land, water and sky, and we had 11 commissions to organise. I basically kind of looked at the spaces and how the artworks would interact with each other, but also stand alone. So that was a key point, really, that there had to be a flow through the building, but also the commissions needed to hold their own as well. Some of the commissions came to me. The first one was the Beaters in Olive Tree, was first shown to me some samples back in 2014, 10 years beforehand. So I always had that in my mind, that would be a beautiful artwork to meet sort of on your as you're entering the Cancer Centre, and knowing that there'd be a large atrium. Some of the works were donated as well, so the bronze swifts and Bruce Munro sort of gave us the time and again at cost price, and that kind of thing. And some things came along, such as Amy Shelton's beautiful Botanica piece, that really came through sort of by chance from an email that she sent me and telling me about her work. And because of, again, it being a light box and radiotherapy, it was perfect to have something like that. So on this occasion, we didn't put call outs for any of the commissions, but instead I curated the programme, and we did a lot of consultation with staff in the centre and also patients to make sure they were happy. And they didn't accept everything. Some things had to go and be put aside, and we go back to the drawing board. But in the end, I think we got something that's coherent and has a good flow about it throughout the building, and also has meaning as well.
Thank you, Hetty. I know that for our big children's unit commission, which is 10 years ago, 12 years ago now, in Salisbury, we did put out a call out in the region. We used the Arts Council website. We had 16 commissions for that, and we sent out a main document that set out the overall themes, and people were invited to send an expression of interest, and from that we created a long list, and then we paid to have people submit a kind of an overarching idea of what they would create for us, and then that went to the steering group for a final decision. So often the best place to follow is to look at where your local hospital is. We talked earlier about that. Where are the public portals? Are they on LinkedIn? Are they on Instagram? Are they on social media? If you follow them, that's often the first place that Hospital Arts will mention that they've got something coming up, whether it's a call out for an open exhibition, or whether it's a commission or work experience or student placement. So if all else fails, you send an email, but definitely follow us on places like LinkedIn. Okay, I'm going to wrap.
Your question, Penny. So
Sorry, thanks. It's been brilliant to have everyone on show, and I'm sure that as an assembly of South West Hospital Arts, we're hoping to have more people join. The network is here. You've got National Arts and Hospitals Network as well, which covers the rest of the UK and Ireland and Scotland and Wales. So there's plenty of infrastructure now. Hospital Arts are one of the biggest creative health infrastructures that have been around for sort of longest amount of time. So there is plenty of support. There are plenty of people that ask questions too. So don't be afraid, be bold and join in. And thanks so much for everyone for your time today.